How's it going, guys? Motionless Gaming here, or also known as Motionless. Today we're going to be doing surgeries, www.surgerysquad.com. We're going to be doing the ingrown toenail removal when it loads. Look at all the different types of surgeries. There's so many. This is the one we're doing now. Is it done loading? A couple years ago I used to have one of these and I had to get the same surgery, so I basically know what's going on. I have a personal experience with it. Okay, I'm gonna turn this up so we can hear it a bit more.
Hello, and welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff, and I'll be guiding you through this procedure today. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose. Improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors.
This is from how much.
There are some ways to treat an ingrown toenail at home to relieve some of the pain, but remember that you should never attempt to remove an ingrown toenail yourself.
Never try
If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one. Our patient is ready, so let's begin by disinfecting the toe.
Okay. Hold on, let me just zoom in so we can see this a bit more.
Now, we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe.
Where? Sorry about my mouse being in the way.
Great. Now we'll wait a few minutes for the toe to get numb.
Oh yeah. Yeah. Jam.
Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. Once you've done that, we can move on to removing the ingrown portion. First, carefully slide one blade of the nail anvil under the affected nail.
Hold on, I'll be right back, guys. Okay, I'm back.
We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail.
Alright, you ready to hear the cracking?
Great!
Forceps.
Take the forceps and carefully remove the ingrown nail.
Then there's pus underneath. You can see it from right here, see it? Right on the right of the forceps. Oh yeah.
It's getting kind of messy in there. Let's clean up that blood. See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe.
You don't say.
Firmly squeeze the edge of the toe to
Ew.
That toe is starting to look much better,
Oh, yeah,
but we're not
indeed.
done yet. Next, we're going to apply some phenyl acid to the wound. This will help ensure that the problem of ingrowth will not reoccur. When you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
Okay.
Finish by applying some antibiotic ointment on a sterile gauze pad. Place it against the toe and wrap it in a gauze bandage. Fantastic job! Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics. We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day. While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail. You did a great job today.
Thank you,
While
Dr.
you're here,
Jeff.
try your hand at one of our other surgeries here at surgerysquad.com.
No. We're going up to... Let me just zoom out. There we go. We're going up to freaking Cosmic. We're gonna try laser hair removal. I'll be back when it loads. How's it going, guys? Motionless Gaming here. And today we're gonna be doing Surgery Squad virtual surgery. Yes, last time we did, pretty sure it was ingrown toenail removal, but now we're gonna be doing braces, and now I'll be back when it loads. And I'm back. About time it loaded. Took it like longer than the other one. Now we're gonna have to wait for this. I'll be back.
Welcome to Surgery Squad. I'm Dr. Jeff, and today we're going to talk about braces, those fantastic bands and wires that help straighten out crooked teeth. Let's face it, most of us do not have perfect teeth. Everyone's smile is unique. Some people's teeth are just a little more out of shape than others. Your teeth might be crooked, or your upper and lower jaws might not be the same size. If your upper jaw is bigger than your lower jaw, that is called an overbite. If your lower jaw is bigger than your upper jaw, you have an underbite. Sometimes your mouth is not large enough for all your teeth. That is referred to as overcrowding. In all of these cases, the problem can be fixed with braces. Braces are a series of brackets, wires, and bands that are used to guide your teeth back into the correct position. This improves looks, makes it easier to chew, and at times even improves speech. Our patient today has what looks to be an overbite. We want to see how noticeable it is. We'll start by getting a record of the current state of her teeth in many ways, including x-rays, impressions, and photographs. We'll start by taking some x-rays.
I'm gonna get a drink of water. Oh, crap.
Next, we'll take an impression of the teeth. We put a special gel on the bite mold. The gel comes in lots of terrific flavors, like candy cane and chocolate cake. Can you put the mold in the mouth? Great job! We'll have my assistant make the bottom impression. Once we have them both, we'll use the impressions to make a plaster model of the patient's teeth. Okay, we've got our impressions and x-rays, and we can see that our patient needs braces. I've also taken some photos for our before and after wall. We'll arrange an appointment for next week to put the braces in place.
Oh yeah, I jam.
Our patient is back, and we're ready to put on her braces. In some cases, a patient may need spacers placed between the teeth for a week to create more room for the bands. Our patient does not. We'll start by polishing all the teeth. Making sure there is no debris on the teeth will ensure that the braces adhere better. Run the polisher over the teeth to clean them. Wow! What a marvelous job! I can almost see myself in those teeth. We need to put on some molar bands to anchor the braces. They circle the whole tooth and have a hook on the outside of the tooth. Slip the molar band over the tooth. We'll cement it into place later. Great. Now we can start putting the bonded brackets on the rest of the teeth. We've placed a lip guard over the teeth to give us room to work. Let's rinse off the teeth. Can you spray them with water? I run the suction to remove the water.
There.
Let's spray some air to get the teeth nice and dry. Can you handle that for me?
No, not at all.
With the teeth dry, we'll now put a small amount of bonding agent on the teeth. Wipe a little bonder on each one. We let the bonder dry for a minute or two so that it is sticky. Then we place a bonded bracket onto it.
Sorry that I'm quiet in all these. I have to concentrate when I do stuff. There we go.
I will scrape off the excess bonding agent with a dental pick. Now use a curing light to harden the bonding agent under the brackets. Click to turn on the curing light. Great job! Now I'll put the bonded brackets on the rest of the teeth. There we are. While I was at it, I readjusted the molar bands and cemented them. We're ready to place the arch wires. The arch wire is a thin wire that connects all of the teeth by going through each bracket. Let's slip the wire into the brackets of the bands on the molars. Move the wire to the mouth to put it in place. Good job! We do not want the wires to poke our patient, so now that they are all snapped into place, I'll reduce the ends by clipping them off with pliers. And there we are! The arch wire is in place. Now we'll use elastic ligatures to make sure the arch wire does not fall out of the band. The ligatures are little rubber bands we snap over the front of the bonded bracket using a different pair of dental pliers. Now you try. Place the ligature over the brackets indicated.
Done.
And with the last ligature in place, our patient is done for today. In the next few days, she might experience some initial discomfort. She should plan on eating soft foods and taking over-the-counter pain relievers if needed. Orthodontic wax can also relieve discomfort. If there is a real problem, she can always call the orthodontist. It is important to take more time brushing and flossing when you have braces, as food can get lodged between the wires and the teeth. Our patient will have regular appointments about once a month for the next 6 months, and then space them out after that. The treatment usually takes about 1 year with braces, and then additional time with a retainer. The true length will vary by patient. She might also need additional equipment such as elastic bands, coil springs, or headgear. We will not know until we see how she responds to the braces. There you have it. The braces are in place, and our patient is on the way to a beautiful straight smile. Thanks for coming by Surgery Squad. Why not check out one of our other procedures here on SurgerySquad.com?
Okay, we're done with this video today. Please like, subscribe, and comment for what surgery I should do next. Here's the surgeries. There's oral, cosmetic, oncology. We already did nail, gynecology, I don't know, the eyes, and the orthopedic. So like, subscribe, and comment. See you guys for today. Bye.